You're welcome to your favorite channel, Talk to Bonnie. And today we will talk on the topic diabetes and the workplace. There are many people living with diabetes who are also workers with wonderful skills. But some of these people experience challenges at the job site that make it difficult for them to have good control, hence affecting work. And what are some of these challenges? Some are not granted permit to visit their healthcare providers for job review or to be sure of their good state of health. Some of the leaders lead in a style that makes the work environment stressful. And remember, people living with diabetes, high blood pressure, and other conditions don't need to work under stressful conditions, as the stress can cause blood sugar levels to increase, hence affecting their output. Some workplaces don't have safe places where they can check their blood sugar levels and safely administer the insulin for those living on insulin. Hence, have to go to sometimes toilets to have the insulin administered when there is no place. And sometimes, when caught by others, are mislabeled as people living on drugs, which is not true. And some of them work shifts that can affect their blood sugar levels. Remember, studies have shown that when someone routinely does night shift duty, it can affect the blood sugar levels to go up. And if the individual is living with diabetes, it can affect management. And so, what are some of the things that leadership can do to make people living with diabetes and some other entities to work comfortably? One, we encourage them to show understanding and grant permission to these people for job reviews or to visit their physicians. They can also ensure that the workplace is led with in a style that the atmosphere is calm, so that some of these people are not under stress, which can affect their valuable numbers. Some of them should also ensure that some of these people can work shifts that are favorable to them or shifts that will not affect their blood sugar levels. Even if they have to do night duties when it arises, let it be controlled, regulated, so it doesn't affect their health adversely as the organization will pay the price. They can also put in place preventive practices by encouraging some health facilities around to come and do screening to the staff while on duty. Like for those in Cameroon, they can invite the Know Your Number service of the CDC Health Services to visit the staff at the workplace and do screening for diabetes and other NCDs. In that way, work time will not be lost as the screening will be ongoing while work is also taking place. They can also ensure that the food being sold at the job site is NCD friendly. In that way, the staff will be eating healthy food to be healthy for greater productivity. And knowing that people living with diabetes need to get up from their seats every 30 minutes to exercise, likewise, even the rest of the staff. When you meet somebody living with diabetes up from the seat and doing some exercises, maybe some squats, etc., stretches, and so on, don't blame them. Rather, appreciate them for doing something to be healthy for greater productivity. These are some important things that I thought necessary to alert our people so we can practice some of these things and have a healthy workforce so that productivity of the organization can continue to improve. Like, comment, subscribe, and share so others can benefit from this information for us to stay healthy and do God's work.